The durable power of attorney, is that only used if the person is not mentally sound to be able to make decisions?
Yes, if there's some exceptions now, and again, you can help me here, but it says if the person is unable to make decisions, then this person that I'm appointing can make decisions. Now, there are times, so we've had, daughters come in and say, wait, I have a POA. I can tell mother's not going to go to nursing home. I can make that decision. The mother's sitting there perfectly alert and oriented and saying, no, I'm going to make the decision about what happens. And so we go by what mother says. But there are times, I think, when, because the person wants someone to handle their finances and, take over their checkbook and that kind of thing, they're still able to make decisions, but they are able to, they get help with their finances.
Yeah, you can have a power of attorney that is either conditional, if it comes into effect upon incapacity or disability or some event, or you can have a power of attorney that's effective immediately. The other thing that Bronwen touched upon that's important to remember is that the individual who creates the power of attorney does not give up any rights that they have. So if they say this is what I want to happen, it doesn't matter what their attorney, in fact, their agent under the power of attorney says. Their wishes should be followed unless they are incapacitated in some manner.
Okay. Thank you for your help, Jay. Well, we're going to go on. I'm going to kind of try to go through these quickly, but another thing would be homemaker service, just someone to come into the home to help with cleaning and cooking and that type of thing. So just maybe some light housework. There are some available through family service on a private pay basis. There are some through Area 4, but there's usually a very long waiting list for those, at least in our community. Another is an emergency response system, particularly for an individual who lives alone. There are several different kinds of emergency response systems, but usually it involves, the person wearing a little pendant around their neck, and for example, the one we have at the hospital, the Lifeline, the machine is kind of plugged into the telephone system and to the electricity, and so if they fall, they push the pendant around their neck. It goes into a central answering service. And for ours, it's the hospital switchboard. There are some that are answered at a centralized location. So they would have these in any community. They would be under various different names. Do you all have one at your company? What's it called?
Direct Link.
Direct Link, okay, Direct Link and various things, but they all provide the same kind of service. Some have add-on services such as medication reminders, but it does help because if your person's living alone, and as I installed one time, and the son said, I go check on mom 3 times a day, but I could walk out the door and get in my car and bingo, she could fall and, before I could get there the next time. So it does alert someone right away. Assistance in paying bills. Sometimes, like I said, the power of attorney can maybe help with getting the bills done. That was a great stress. My father finally decided it was okay. It was time to turn that over to my sister. So, but that's very important. The Area 4 locally has a representative payee that can actually receive the Social Security checks and dispense money to someone who's just not able to kind of keep track of their expenses. If someone has more funds, many times a bank trust officer will take that part over, and there's usually a fee attached to that. There are care managers, and we have a care manager right here, and with Granger Care Services, and there aren't too many in town. I think Melissa Nelson's actually moving, so. I know. But we did utilize this for my father and my parents in Texas, but had a care manager come out and just do a full assessment of what is going on in the home. And this is kind of good for people who are living a distance away and can make recommendations then about what the services are. There's usually a fee attached, for that. But they can provide any number of services. And this is a growing field, I think, that is starting up. So you may be able to find those even in the Yellow Pages in the mother's community. Transportation services, that's a huge issue, and there are always times to need more of that. Many times we're fortunate that we do have like the caravan through the senior center. It takes many people to doctor's appointments, even grocery shopping. The surrounding communities have vans that will bring people into the doctor's office. There's sometimes a small fee attached or a donation. in Lafayette, we also have the access bus for people who are disabled and need some regular appointments, and they will just kind of, they don't help them into and out of, they just will come and pick them up, but they're more accessible. Home delivered meals are always good because the person sometimes just doesn't want to cook anymore, or they're not eating well or properly. So in any community, you're going to find some type of home delivered meals. There are Meals on Wheels here through the hospital, but they're limited in terms of their delivery area because they're dependent on volunteers. And Area 4 Agency on Aging can help with those that are out in the surrounding communities. Sometimes they may deliver like 5 frozen meals at a time. The Meals on Wheels will do hot meals 5 days a week and extras on the weekend if they need to. I have down here number 9 is the choice and Medicaid waiver. These are services that are paid for through the state. They will provide a lot of services in the home. The choice, and I'm not sure I could say what all, community, home, options.
You never get it on.
Anyway, it's an acronym for something. There's a very long waiting list for that. Medicaid waiver, these are people that are already on Medicaid, and I've understood recently that this is a very short waiting list, so that is a possibility, and they'll provide up to a certain number of hours of services in the home. If I turn it over, I think I said that already. They wait